Excellent. Welcome, everybody. My name is Hema Sarang-Saminsky, and I am the Deputy Director of Jane Doe, Inc., the Massachusetts Coalition Against Sexual Assault and Domestic Violence. And I am so excited to be sitting with all of you today as we embark on this project kickoff. And let's see, I'm just taking a look at my view. I'm sorry, checking one technical issue here. Okay, I think we are all set. I think we're ready to advance the slide. So how we come here today is really the subject of what we will be talking about for the next hour or so. And really at the core of our conversation today is the question of what is possible when we listen to survivors, examine our practices with honesty and compassion, identify what needs to change, and imagine a world where our responses to harm are transformed towards care. So that's our opening question that we are entering into this conversation today as we navigate what it means to support survivors, as we navigate and survivors navigate child welfare systems or family policing systems, as we call them in Massachusetts. That is the range of interventions from the Department of Children and Families, DCF, formerly referred to as DSS. And we're so excited to begin to dig into our work as a coalition to talk about what we want to see in terms of our responses. What is happening? What are we doing as a coalition, as programs to support survivors as we all navigate these complex systems? And we are so grateful to sit in partnership with a wonderful team who we're going to start introducing in just a moment. I think we're ready to go on to the next slide. Awesome. Oops. I think we might have skipped ahead to the last slide just to get into our introductions of partners.
Apologies, y'all. I think my computer's a bit behind. It is catching up. One moment.
No problem.
Okay, are you seeing the title slide now?
Partnership. Excellent. Excellent.
Okay, great.
Yeah,
Sorry.
maybe we can go off share screen and just so that we are all, you get to connect names and faces a bit more clearly. Excellent. So I'm going to turn this over first to our features team. I'm really excited to have you all introduce yourselves, and also to Harmony One, to Dr. Eloise Cepeda. I'm going to let you all kick it off and begin the intros.
Thanks, Hema. I'll start, and if we could also pin our colleague Shelley Taggart on the future side, that would be fantastic. So hello, there's Shelley. Hello, everyone. Welcome. Really great to be in community with you. My name is Tian Ung. I use she, her pronouns. Really happy to be a part of this partnership. I'm housed at Futures Without Violence at the Boston office. And I come to this work as a survivor of childhood sexual assault, a survivor of adult sexual assault, and also a survivor of childhood exposure to domestic violence. And I do this work because earlier on in my career, because of all of the experiences that I had, I was trying to make sense and make meaning and heal. And so in many ways, I felt like I was doing the work because I had to do the work. I'm trained as a clinical social worker by background, and I've worked across multiple settings and DCF. I was at DCF for about almost a decade, and then worked in the courts doing forensic social work, as well as in child and family trauma clinics. But also as a person of color and a bilingual, bicultural person, I feel like, I know I don't look that old, but it's been 30 years in the field. And it's sort of the last 15 years or so where I've really sort of given myself, and in communities with others, like the people that you see on the screen here, been encouraged and given permission to step out of my formal training, be back in community, and think about all those questions that Hema just teed up. What does healing look like? What does walking beside somebody from the hardest moments of their lives to sort of the most liberating moments of their lives look like? And I've really enjoyed that work, and I'm hoping to bring some of that experience here in partnership with you, to sort of put some of my training aside and to be in community and to develop new and innovative models of practice that may not necessarily orient or prioritize, clinical practice, but healing and liberation. And so we'll talk about that a little more, and I'll pass it off to Mari.
Thanks so much, Tian. Hi, everyone. My name is Mari Beihauer. My pronouns are she, her, hers, and I am a program specialist on the children's team at Futures Without Violence. I've been with Futures for about 2.5 years. And additionally, I have experience in reproductive justice and transportation justice, but really during my time at Futures, I've been learning from folks like you all, your experiences with survivors and filling their needs, finding out what works best for them, the challenges. And I think we're really here to help you figure out how to best serve those needs and tackle those challenges that come up. So yes, I'm very excited to work with you all, and I'll pass it to Shelley.
Hey everyone, I'm Shelley Taggart. So I have a very long history here in Massachusetts in domestic violence and child welfare work. I'm going to really date myself with this introduction now. In 1994, I worked at Necesidades, which is now Safe Passage. So that was back in the day. I was one of the first safe plan advocates in the state. So that also takes you back. I know that's been a long-standing program now. And I came to work, I worked in the public child welfare system here in Massachusetts with our colleague Lana Davis, who wasn't able to join us today, but will also be, contributing to this project. So I guess I'm saying all that because I'm also a survivor myself, not of the child welfare system, but a survivor of domestic violence and sexual assault. And I'm just really happy to be doing work in Massachusetts. Most recently, we had some actually 4 different offices in Massachusetts DCF for the that were part of the Quality Improvement Center on domestic violence and child welfare that I ran from here at Futures. So I feel like I'm back home. I live in Massachusetts, and it's good to see all of you. And I'm very excited to be on this journey with you of figuring out how we can, as Tien says, sort of continue our deepening of our work of walking alongside survivors to make sure that survivors get what they need. And we think about children as survivors too. So when I say survivors, I mean adult and child survivors. So thanks for having us. And I'm going to turn this over to our colleague, Eloise.
Thank you, Shelley. And I'm so glad you said children are survivors too. I often say children survivors grow up to be adults, and the healing journey is a lifelong journey. And so I agree. Hello, everyone. My name is Eloise Cepeda, and I am the founder of Harmony One Restorative Justice, which I launched in 2010. I've been on the field, various fields, multidisciplinary fields since 1999. So I dated myself too, Shelley. I am also a child and adult survivor of family violence, witnessing domestic violence, and also being a child who received very harsh forms of punishment as well. domestic violence in my own personal relationship and journey, sexual assault, dual domestic violence and sexual assault, and stranger sexual assault. And with that, we all know comes with strangulation, stalking. I've experienced, and my children have experienced homelessness and other forms of community crime. I'm also a survivor of the child welfare system. Through that journey, been reported and also have navigated intergenerational trauma from child welfare. My father and all of his siblings were separated from my grandmother, who is Indigenous. I am Latina and Indigenous of Kickapoo Nation, and we have felt the impact of that for a very long time, still learning who family is. Harmony One is focused on restorative justice and transformative justice. I am a SME in that field, a subject matter expert in that field. We focus heavily on racial equity, systemic racism and oppression. We serve survivors on an individual level as well. Partner with local, state, and national partners who are also doing this amazing work to make a difference in the lives of survivors and child survivors. We really also focus on intergenerational trauma and healing. And what does that look like? Who needs to be a part of that? And co-creating new pathways to help and support people who are supporting survivors, and to center survivors in the work that it is that we do. So I'm very, very honored to be on this journey and this launch with you all. And I will kick it back over to Hema.
I'm grateful to all of you and those beautiful introductions. So I want to just talk a little bit about our team and bring their names into this space. You'll know many of them already as members, and we'll continue to get to know folks as we unfold this project. But I just want to do a shout out to Deborah Robin, our executive director, Nithya Badrinath, our associate director of policy and advocacy, Nani Sajib, our director of education, Esther Rogers, our director of housing and economic justice, and Ren Liu, our communications and outreach manager. These are core members of the team that are going to be supporting this work in a number of different ways in the months ahead. And we're just really grateful to be in this partnership with all of you at Futures in Harmony One, and with our members, with all of you members, for being really the leaders of bringing this issue and these conversations over and over again, and naming these, that this is what we need to be talking about in this moment in our field. So thank you for that. And I'll talk a little bit more about that process and how this came to be in a moment. Okay, so how we got here. So back, there is a long history in Massachusetts that, certainly these experts in this room today can certainly speak to, many of whom have been deeply involved with and part of the long history in Massachusetts of addressing the places for change within existing child welfare system, state responses, opportunities to create more survivor-centered practices within existing state systems, and the many, many folks who've worked with survivors and programs who have been imagining and strategizing about what else is possible for a long time. And Massachusetts is home to a lot of that history that we can certainly get into as this project unfolds. But how we got here as JDI, as the state coalition, is really from a number of conversations that emerged over the past few years in at least in a louder volume, around what it means that we have the realities of these state interventions through systems like DCF that do come into our work with survivors every day in our own programs. In 2020, we began conversations at the coalition that many of you were part of on what we called shifting our reliance on criminal legal systems. We joined in conversations that were happening across the country about what it means to rely so heavily on policing practices, on law enforcement. And in our own field and in this coalition, we started talking about, well, what does that mean for us as sexual assault and domestic violence focused advocates? And in those conversations, they were beautiful and honest and long conversations about our own role and history, and sometimes dependence on and resistance to these systems. Out of that came a conversation around, well, what about DCF? What about other systems that aren't law enforcement, perhaps in the traditional policing sense, but what about child welfare systems? What about the policing of families? And those conversations came up a lot, and I'm so grateful to every one of you. Many of you are here, and I see you, for bringing that attention repeatedly to us. And as we sat with some of those questions in some of our breakout convenings, we got into the realities of, okay, here we are. We're working with these systems that sometimes we're working with survivors who have already been tied up in these systems and are coming to us for support and healing. Other times there are moments where we have seen ourselves or colleagues having to engage with those systems through mandatory reporting obligations. And the pain points, the many pain points and decision points along that clearly have really led to a lot of deep questioning and deep conversations among the membership. So that's a little bit about the how we got here and really wanting to think about what do we need to know and where do we move forward to as a coalition. So I'll pause there because we can talk about that forever.
Next slide, Mark.
I think we're ready to go one more slide forward.
Thanks so much. So just layering on to what Hema just laid out in terms of the conversations that you all have been having in community, we wanted to take, just a few minutes to kind of begin with the end in mind, maybe, so you can get a sense of what it is that we're hoping that we will be able to do together in community. And so, at the finish of this endeavor, we're hoping in partnership with you and collectively in community, we will be able to generate and design together restorative and transformative approaches to innovations in child welfare practice at the intersection of service to adult survivors of sexual assault and domestic violence who are also child welfare impacted. And so what we hope to do in order to get there is to come together and to host a learning community, a monthly learning community with you all that my colleague Shelley will talk about. In that space, we're hoping to refuel, energize, and strive to create some knowledge and understanding together. We'll be drawing a lot on human-centered, liberating, healing approaches to really explore and learn from you all. What are some of your best practices in this space? As Hema was saying, what are some of your challenges and some of your pain points. And we also hope together in conversation and collectively, we will generate some alternatives to mandatory reporting when possible, and that the whole of our work, as we sunset this initiative, will lend itself to some policy recommendations that we can co-create from these conversations and this learning that we'll do with you. Next slide, Marley. So how we hope to get there, to that vision and that hope of where we hope to land, is first and foremost, we want to begin by listening and learning from you. As Hema said, we know you have been in conversation about this more than once, and we also know that you are the ones sort of leading the work on the ground in your communities. And so we will work with some of you to generate and create a survey so that we can learn a little more about your experiences with restorative and transformative justice practices, your experiences with mandatory reporting in the child welfare system, your experiences in supporting and supporting the well-being of impacted survivors. We will use the learning community, or the communities of practice, as we're calling them, to harvest and lift up some of the innovations that you all have created from your practice wisdom in partnership with survivors locally. And then we will learn and design and explore together with you perhaps new approaches through a restorative and transformative justice lens. And in this space, I'm going to invite our colleague, Eloise Cepeda, to hop in here and tell you a little bit more about what restorative and transformative justice practices and approaches are and how it might show up in the space, and why that frame is a frame that we want to design with you from.
Thank you so much, Tian and team. So as we all know, becoming a victim and survivor of crime is a very traumatic experience. Many survivors feel as if their lives have been turned upside down and experience a deep loss of power, safety, and fear. Not just fear of the person who used violence against them, but also what's next with voluntary and involuntary system involvement, also referred to as intervention, and the inclusiveness of the nuances of services and people that are serving survivors. Meaning, is there a organization or a service provider that can understand and help me to achieve my goals? Is that service provider focused on what my needs and my ideas are and what justice looks like to me? And so finding and navigating these systems can be just as stressful, as you all know. What once was normal and familiar no longer feels safe. The unknown, as we all are aware, can be more stressful than navigating day-to-day survival. As we know, violence can increase when a survivor leaves, and so can surveillance. The criminal and civil process can be daunting and very complex, considering the systems often don't talk to each other. And as we all know, survivors are really leaning on us to help bridge those gaps. The survivor is usually overwhelmed with processes and people. In our experience, majority survivors voice that they do not know who they are talking to and what department they belong to, because there's such an overlap between civil and criminal systems. Leaving is also an additional obstacle that survivors have to navigate, and can be accused of not keeping their children's well-being at interest, because they're likely to end in a situation that is called homelessness. We have identified in our work harm and impact of navigating these intersections of multi-systems while enduring the complex systems and cultural barriers due to the unique intersectionalities, which includes all the nuts and bolts that make of a person, or race, ethnicity, culture, religion, social status, and so on. And everyone's individual needs that are unique within this harmful and traumatic experience. Restorative justice is a practice that focuses on individual and community strengths, impact, and needs, while transformative justice focuses on the systemic infrastructures that perpetuate racism and oppression, while serving and supporting survivors and their children and people who have caused harm. Restorative justice gives the framework, the survivor a framework to communicate with people in a structured and co-created manner with legal representatives, service providers, with the person who used violence, if they are comfortable. And if not, there are many, many methods that a survivor can utilize to feel like they have regained power or their voices being heard and recognized, and even leading the work towards their healing journey. They can also include chosen service or support people. It can be someone from their community, their family, and lastly, legal representation of their choice, service providers such as yourselves, educators that are serving and supporting their children at school, which can also likely reduce additional reports made to child welfare if the educators are not brought into, or health providers are not brought into the larger plan. This process is completely based on the preparation and felt safety of the survivors and others involved. And transformative justice leads us to the opportunity and the unique prism of time to co-create new pathways to supporting survivors, their children, and again, can include people who've used violence, community, legal, and service representatives. We've seen, again, this work at local and micro to macro level partnerships. One of the examples of utilizing RJTJ is what we call it, restorative justice, transformative justice, at the intersection of domestic violence, sexual assault, and child welfare, is increasing and enhancing support at the moment, at the point of contact. We say at the hello. That process, when incorporated, really helped us also to identify the depths of the referrals that we were receiving. Many survivors were referred to us for support due to domestic violence, and then we were able to identify that there was also additional sexual assault and even human trafficking in those we call hidden referrals. We've also been able to review and revise policy that is executed around mandatory reporting and shifted to identifying protective factors, filing with survivors, if and when a report needed to be made, deciding what are the alternatives to mandatory reporting, and what is the internal accountability gauges that are set in place to ensure equitable efforts. So how do we know that we're really tackling that gray area of discretion and biases and a lack of understanding of cultural differences? Through that particular project, we were able to achieve approximately 70% of family preservation and reunification, which involved success team planning with with CPS courts, legal representatives, educators, other service providers, all surrounded around the survivor's needs, and the survivor would drive the entire process with our support. Through that work, we also were able to bridge collaboration practices through civil and criminal processes and policies as well, including the protective order division and CPS court, where civil side is ordering stay away agreements and criminal side is ordering protective orders. And then what happens when one falls through and the other doesn't, or one is dismissed and the other isn't. That we saw a lot of families who were put back in danger because the check boxes were done, parenting classes were done and whatnot, and the person who used violence would go and amend their protective order, and then that would position the survivor and children to be put back in danger. So again, we're looking at all of the factors and obstacles that the survivor is having to navigate because they're driving this process. And then we've also been able to utilize it in through community collaboratives. There's an amazing fatherhood organization that we work with who works towards supporting people who have used violence. Through that work, we also have learned, and we know this, but we've learned and been able to really evaluate the data and the statistics of families that want to reunite. They believe, okay, my case is closed, violence is stopped, and we want to try again to be a family. What's been lacking in that process is the reunification and re-entry practices, which is inclusive in the restorative justice work that we do. Through that work, we were able, one story that I'll tell quickly is there was a family that had made a choice to reunite. They wanted dad to come home. They wanted a fresh start. And so we had a period of preparation time. And then it's a process of dyads, then triads, and then family. And we got to the family part, and the son, the mother, the father were in this restorative circle, and they're having a real conversation about what the impact of the violence was, what the impact of the separation was. They had to move, mom couldn't afford rent, all of these things that would be underlying and causing, undealt with harm and unspoken harm. And the son was able to say, Dad, I was really afraid that you were going to be mad at me, that you weren't going to forgive me. And I didn't know how this was going to turn out with you coming home, because I'm the one that called 911. And Dad was able to say, you did the right thing. Like, I was doing the wrong thing. And this is what I've learned on my journey. And mom was able to say, I was, really hurt because, we had to move and I had to pick up extra shifts. And this is the burden I carried with the children. And we were able to see over this process of time and efforts, this family really enter into a healing stage that they all wanted to be in. And this was about 3 years ago. I checked in. I get to see this family often because the father serves now as an alumni for the fatherhood program. And this family is doing amazing. They're thriving. They feel a sense of well-being and so forth. And so we're really seeing what the impacts can be, the positive impacts can be through the restorative justice, transformative justice work that we're able to engage with families. And so that's the brief. We don't expect you to get a full session of TJ understanding today. Again, this is an introduction, and I really look forward to working alongside each of you so that we can continue to explore what that looks like for you in your field and in your realm of work. Tian?
Thanks, Eloise. We can go to the next slide. That was lovely. I appreciate you. So what we want to do now is just a couple more slides, this one and one other, and then we want to have a conversation with you all. But if we can go back to the project timeline, as I was saying, we're kicking off today. Yay! So excited. Really eager to begin to learn from you. We'll be launching a survey probably at the end of April, beginning of May. We'd like to host a couple of focus groups, again, because as Hema was saying, we recognize that there is a lot of wisdom in this room. There are innovations and practices that you all are driving and creating in response to what you're seeing in real time with survivors. And we want to make sure we understand that. And we also understand that there are a lot of complexities and challenges and pain points that you feel trying to center survivors when, as Hema was saying, maybe surveillance systems, or as Eloise was saying, policing systems and protection systems have different goals and expectations, and trying to kind of navigate your goals and your approaches with the demands of the systems that the survivors are also involved in. So we're going to spend the first couple of months really learning from you, and then we will pour all of that learning into the design and the launch of communities of practice, which we'll talk about very briefly. And we'll host those communities of practice from June to December, which is when we'll sort of sunset this initiative. And in that time, we're hoping to, again, construct with you new and innovative practices that are anchored in restorative and transformative justice perspectives, as well as policy recommendations, all organized around how to best serve child welfare impacted or system involved survivors of sexual assault and domestic violence. Next slide.
Thanks, Tien and Eloise. So let's just talk for a moment about the community of practice that Tien was just describing, happening from June till about December. These will be 90-minute sessions each month for us to learn and create together. So the things that define sort of a community of practice is the co-creation of our learning agenda, like what do we want to be doing together. You know, we'll probably start out with some questions about sort of tell us about your passions in this area, tell us about those pain points. We'll try to get under some of the things that you know, may be touched on in the survey, but you know, you can't really sort of get into the nuance of things until you're in conversation with each other. And all of it sort of in service of this vision that we have been talking about, making sure that survivors are having better experiences, both, you know, of avoiding child welfare involvement, frankly, and within the child welfare system as well. So I hope that you're feeling sort of excited about this, that the idea, again, of a community of practices, we have a conversation with each other, we sort of talk about, you know, what it is that we want to learn, what it is that we want to get better at in conversation with each other. And you know, everybody brings sort of their wisdom and their knowledge and their learning and their creative brains sort of into the space, so that we are co-designing these new strategies together, as Tien has been talking about. And we do think that a lot of this, because we know that the child welfare system is always sort of a pain point for folks, like in general, we'll start with some of the pieces around mandated reporting, because we know that there are tensions and nuances even within that very small slice of child welfare. It is the entry into this very oppressive, sort of harmful system. And we know that you all are in the position of being mandated to report at times, and you know, and we want to sort of think about some of those issues. Like when I was listening to Eloise talk, she was talking about this issue of making sure that we're upholding equity, for example. And one of the ways that that shows up in a mandated reporting space is to start thinking about, you know, from the perspective of a domestic violence program or a shelter program, what are your practices and what are your learnings, both about survivors who are parenting in public in your shelter, and those survivors who are coming in 1 hour a week or whatever for a support group or for a peer support session. And, you know, are there sort of equitable decision-making processes within that space? So, you know, I think all of these things that Tien and Eloise have been talking about are things that we do the job of sort of mining and uncovering and exploring together what is possible in the world. And then as you see sort of on this last bullet on this particular slide, turning those into a blueprint for action is really the ultimate goal. But it will be a blueprint for action, not that we're bringing to you, but that we are creating together, because Massachusetts has a particular political climate and a particular sort of set of mandated reporting laws and a particular child welfare system that doesn't exist anywhere else. You know, every state is unique. So the blueprint will really be a shared blueprint for action. And that feels really very exciting. So I hope y'all are getting as excited about it as we are. And I think at this point, Mari, we want to go to the discussion slide. And I know Tien has to leave, so thanks very much, Tien. But I'm not sure if that's immediately or yes, you are. Okay, so I just that you put something in the chat.
I can wait a couple more minutes, and maybe we can come back in community rather than have
That would be
slides.
great, so we can see each other.
We can see each other, and we're happy to take questions that you all might have, reflections that we've had, anything that clarifications that you're looking for, worries that you might have as you're digesting all of this.
So really the question is like, what are you all sitting there thinking about right now? Related to this topic, what are you interested in? What do you want to talk a little bit more about while we've got the time here today?
That's great, Shelley. Joanne.
My thought is I might stop recording at this stage if that is okay for folks.
Yeah,
Just
that's a great idea.
ask questions as you wish.